Hello and welcome to the continuation of our assessments information. So this is chapter 12 of the Nasm CPT study information. Last lecture was based on chapter 11, which was more of what we would call your health, wellness, and fitness assessments. This is going to move us into our postural, our movement, and our performance basis, so more dynamic types of assessment basis here. But understand too that I say dynamic because majority of these are movement. Understand that some of them might be static based. So let's get into that, explain why that's the case and what we are going to do with that. So there are a lot of really good pictures that we're going to be able to see, a lot of good diagrams in here. So pay attention to the locations, pay attention to the verbiage that's on the side of those, because those are always going to be really good to stop, pause, and basically have this really good set of notes that you could take based on that. So again, we did health, wellness, and fitness. So we got baseline information. We got really good demographic information that's going to tell us about that person. Well, now we want to be able to assess, truly assess the body. Well, the first thing we want to work on, like it says here, is posture assessment. So static and dynamic. Static meaning motionless, dynamic meaning with motion. All right. So with these postural assessments, we are going to just basically see what the body is going to do under specific non-loaded environments. How the body is shaped. Is there any imbalances? Are there any specific limitations? Are there any other factors that can be associated with that? So also with that, what we're going to do is we're going to do some movement assessments that are going to take us through how we can see any differences in movement impairments. So like if you're doing a push or a pull assessment, we can definitely see what's going on and how the optimal motion should be versus what you might see being non-optimal or impaired. And then lastly, we're going to go through the performance assessments that we have that are going to assess strength and muscular endurance, power, and then agility. And those aren't dictated just, and dedicated just to athletes. So whenever you see those words, understand that it could be for anybody, but it's got to be for the right instance. All right. So again, this is something that we've hit on before in terms of muscular imbalances. So we have to make sure that we're working through our over and underactive. Overactive meaning that you're compensating on one side, that one side is constantly shortened, while the other underactive is that there is no sort of impulse to that. Well, I don't want to say that. That's the wrong way to say it. But there's less influence of the muscle at that point if it's underactive, because it's not as strong and it's being influenced by the overactivity of another muscle group. All right, so that's what, getting into that, back into that length tension relationship, or muscles basically being at rest, and how that would work. So with static posture, we want to make sure that we're, again, visually observing, looking at somebody from the specific standpoints of anterior, frontal position, like frontal view, side view, lateral, posterior, back view, because even though the front and the side may look good, the back may not. Or if the back and the side look good, the front might not, or the side might not, but the front and back do. So there's always those ways to work around it. But always understand, and I'll highlight right here, foot, ankle, knees, lumbo-pelvic hip complex, shoulders, and head are our go-tos. Those are our specific locations that we want to pay attention to. The foot and ankle, the knee, the lumbo-pelvic hip complex, the hip complex, from the side view, that is going to be, basically where the ball of the femur runs into. From the front, it's that midsection. All right. And then the shoulders and then the head, all of those have specific alignments that we're going to be looking for, especially during, like I said, that static posture where you're not moving. So again, I'll blow this up a little bit bigger just so you can kind of see it a little bit clearer. But here is there's again those 5 checkpoints. There's your foot and ankle, your knee, your lumbo-pelvic hip complex, your shoulders and thoracic spine, and your head and cervical spine. So all of those locations, and if you see, it's going to form that grid. From this is now from the anterior view. What we're looking for is, are the shoulders having a nice squared appearance to them? Is the hip complex nice and straight across? Does the line from the basically the iliac crest of the hip, the top part of the hip, go straight down through the knee and then directly through the ankle? Or is there some sort of sway or some other impairment that we see or imbalance that we see? Does the head basically run straight down in the middle of the head? Does it run straight down through, and not being graphic, but through your midsection, your crotch area? So this is where we are looking for those pinpoint locations. Now, you are very much welcome to do this with the naked eye. Okay, you're definitely able to look and observe this in a moment. My suggestion is always to err on the side of caution, because you always want to have frame of reference. Is, ask if your clients are willing to do pictures, all right? And those pictures will obviously be left in confidence that you're not going to do anything with them, and that you are going to use them for the sole purpose that you want to see where imbalances are. So that definitely helps, because you can see all angles at that point. Now, again, the anterior view also, straight and parallel for the feet. So we're looking at those aspects as well, all right, because we want those imaginary lines to be where they're shown. From a lateral view, there we go again. The one thing we want to pay attention to is the ear, okay? From the head down, we want to see that line start right pretty close, really kind of more that temporal position, but right through the ear, basically down through the midpoint of your shoulder, running down through just slightly behind that midpoint of the hip, definitely behind the knee, and then directly through the ankle. And that line of sight is what we want to see for optimal positioning. All right. Now we can start seeing, especially in this midsection here, the LPHC. If we have somebody who has like an anteriorly tilted hip, what will happen is they might start having a little bit more of that rounded lower back, and then you'll start to see this midsection line right in the middle here. That would be more angled more toward the anterior downward position, like you're going to dump out a pail of water. All right, so depending upon where individuals are in their posture, you might have a forward head. Well, a forward head is going to put your shoulders out of alignment. It's going to put your hips and knees and ankles out of alignment. So we're always looking again for these locations. This is where, again, a side view picture, and we could basically take a Sharpie if we were to, or even on a paint app, we can take and run a line directly through and see, where these lines of sight are. Right, very, very critical to understand that. And then from a posterior view, again, our 5 key points that we're looking for. But if you look, there's a couple additional lines here, and that's basically saying, are the scapula in alignment at that point? Are they running about the same? Now, right and left side imbalance can occur. We know that. We know that from side to side we might have a little bit of a difference, but understand that this is part of that process of finding out those limitations, okay? So we're looking for those pinpoints, again, the hip, the shoulder, the head, the knees, and the ankle. But this is from the back side as well, okay? Also with the feet, you're looking for, especially from the back view, look at their shoes or look at their feet and see if you're starting to see maybe the heel is in a different position, if their toes are starting to swing out. You might see their arches being a little bit off in positioning. So these are all things that we want to pay attention to at these levels. So what we want to know, though, is if anything is out of alignment, all right, if there seems to be some sort of an imbalance somewhere, or if we looked at going back to some of the terminology, if there are any impairments that we're seeing, with that posture. Well, what are they? Well, pes plantis, lower cross, and upper cross syndrome. All right. So if anything, make sure that you know these 3 characteristics for the 3 distortion patterns, because this might be something that pops up on your test that might say, what distortion pattern is characterized by forward head and protracted rounded shoulders. You'd say upper cross. Okay. So let's get into the 3 of them. First one is pes plantis. If you look, all right, at the ankle joint, you can see that you have what we would call a collapsed arch, okay? That collapsed arch is causing you to have what we would call eversion, or the sole of the foot start to flare out, all right? The knee joint, you can see if you look at the line of sight of the femur and of the tib fib, you'll see that you're a little bit more bow-legged, which we call knee valgus, all right? And there's a little bit of what we would call internal rotation, meaning that the femur is rotating in. At the hip joint, you can see here we're adducted, we're pushing our knees together, so we're going toward the midline and internally rotated as well. Now, going through, you can see the potential muscle imbalances. Pay attention to the over and underactive muscles here. As in overactive would be the gastrocnemius and the soleus, so the calves are overactive, the adductors are overactive, pulling those knees in, and the hip flexors as well, which will cause internal rotation. Underactive, meaning that they need to be strengthened at some point. Overactive would need to be stretched. Underactive are the anterior and posterior tibialis, so that right in the front part of your shin here. And the glute maximus and medius are not causing the femur to kick back and be externally rotated. With lower cross, think about it from the perspective of positioning. Lower cross means lower back. So what we're looking at here from the hip joint is what we would say is it's flexed. You can see here that by flex, meaning that we're pulling basically almost like the torso downward and, causing this little bit of a shift in angle from upper to lower body. The pelvis is anteriorly tilted. You can drastically see that this person has, they almost have like a shifted butt, meaning that their butt looks like it's raised, and you start to see that angle down. And then, of course, your lumbar spine has that shift of really drastic concave type of, basically bending in motion. So your overactives here, your hip flexors, because the front is pulling so heavy, and then your lumbar extensors of your low back are very aggressive at that point as well. What are underactive are your glutes, your glute maximus, your hamstrings, and your abdomen. And they're not strong enough to hold you back into that position. So it's basically allowing you to fall forward. All right, so that's lower cross syndrome. Then upper cross syndrome, now this is extremely exaggerated, but you get the idea. Upper cross is upper back, lower cross is lower back. Upper cross, you have that little bit more of that hunchback shape with a forward head position posture. So what we have, like we said here, the thoracic spine or that mid spine, T1 to 12, is what we would call excessive kyphosis or hunchback, where that positioning is flexed. Okay, the shoulders are protracted. They're a little bit more like rotated forward. Okay, rounded forward, not rotated, excuse me. And there's some internal rotation or like a turning in. And then the head and the neck is jutted forward. It's not that you are in extension or flexion, it's just the cervical spine moves in that way. So what are your overactives in this case? Well, your pecs. Your pecs are going to pull those shoulders forward. The levator scapula and the sternocleidomastoid, which are in the front portion of your neck, are pulling that neck forward. And your upper traps, again, the upper traps are going to pull forward. That's what's going to cause this rounded upper back. Things that are underactive, your mid and lower traps down in the lower region. And then your rhomboids, and they are basically weak, so they're not able to pull that back into posture. And then your deep cervical flexors that are deep within the muscles that are going to flex the neck, that are, those are going to be weak too. So it basically allows for everything to flop forward. Okay. So you have no neck control at that point, and that's why the head wants to do what it wants to do. So all of those are characterized by where the location is. Pes plantis is in the, that's not as easy to remember, but understand that pes plantis is all about the feet and the feet and the legs, whereas lower cross is lower back and upper cross is upper cross is upper back. All right. So those are what we would look for first. These are static positions, meaning that you are going to have a person stand in front of you and you're going to be looking for these types of environment. Now, some of them are exaggerated, but there are conditions that are a little bit, again, this is why pictures really can do a service. And one of the other things you want to make sure too, appropriate clothing for this is really going to make a difference. So the tighter the fit of the clothing, the better you can see these shapes of the person's posture. So, like for a guy, having a guy wear solely a pair of shorts would help greatly to see everything. Now, again, it's based on comfort, but it would definitely help. Females, a sports bra, halter top, tank top, and then shorts also make a huge difference so that you can see these locations. And the more drapier they are, the harder it is to see the outline of the body, so it's harder to see where the dysfunction lies. So we observed static. We want to move into movement now. Now, these are dynamic posture. This isn't about strength or push-pull. This is more about, we're going to put your body through some motion. Well, actually, push-pull would be part of this, but we're going to get into just body motion first before we introduce equipment, is more like what we want to say. All right. So the movements that we're going to do include some balancing, some squatting, some pushing, and some pulling. And it's going to go overhead squat, single leg squat, a pushing exercise, and then a pulling exercise in that order. Overhead squat, single leg squat, pushing assessment, pulling assessment. And we want to see, again, those 5 kinetic chain points and from anterior, posterior, and lateral views. So your overhead squat, there's the starting position here. If you notice, the palms are facing forward, person is extended completely. All right. And then we're going to move them through. So pay attention to your starting points. Foot and ankle complex is neutral. We don't want to have toes flared in or toes flared out. We want to be able to have our arms completely overhead. Our elbows, this is where it gets tricky. Some people can't get to this position, but we want to be elbows fully extended to that person's limitations. Now, myself, I can't. Mine look like they're not fully extended, but it's just my posture or the way that my structure of my arms are. It looks like I have a slight little bend, but I don't. It's fully extended. So you have to be very clear to say, okay, extend your elbows. Do not lock them unless you're having, only, or if you do lock them, only lock them to a very light position. All right, so that we can get to that overhead in the proper way. Now, it says here shoes off are preferable, and I agree with that. I mean, shoes and socks would be great, but if you can get at least the shoes off and have socks only, that's what we want to do, because we want to see what the feet do when we go into that squatting motion. Okay, so again, squatting, what is the main thing here? I mean, obviously, this is the anterior view. This is the lateral view. You can do a posterior view if you'd like. But for now, what we're seeing here is we want to make sure that the femur is parallel to the ground. That's the key point. That's going to be something that you probably will be asked on a test. Okay? But again, squat depth, depending upon who the person is, can be reduced based on their ability level and if maybe they've had a pre-existing injury or anything like that. Okay? So what you're going to have them do, 5 reps. 5 reps. And the first rep might look really good. The 5th rep might look a little bit more not so good. And that's because the body is adjusting and letting itself kind of, you're relaxing a little bit more in the positioning. And so that when you relax more, surprisingly enough, the muscles that are imbalanced, if they are going to move you. And so when you have the final ending position and you're watching this person go through that final ending range of motion, you're going to see on that 5th rep where that person really is and what they're really doing. Instead of the first couple reps, they're really trying to make sure they're doing the reps right. So this is, again, your anterior view, looking for some negatives here. Feet turning out slightly, that would indicate external rotation. The knees caving in, that, could be another one. Knee valgus, okay? Feet turning out, that could also mean that you might start getting some varus or the knees coming out. But for right now, we're looking at the toes. Toes and knees for this one here. And if you notice, this person's, again, their head is not in optimal alignment. Their shoulders are not in optimal alignment. So there's a lot going on there that we're seeing just from the front, but we'll see it more from the lateral side. All right? Lateral, can't get into full depth. They can't get the hips down, and that affects that whole upper positioning. They might be able to start getting to full depth, but then their lower back starts rounding in the center. And then the other one is going to be their arms falling forward. So although this person in the center has low back arching, their arms are still in alignment, whereas this person, their arms are falling, even though they might be in optimal, spinal alignment. So we're always paying attention to those impairments at that point. So what we want to do is use this chart here. You can, and you can develop your own, but this is the chart that you'd want to do checkpoints for so that you can see what the common conditions are. What's overactive, what's underactive, and then we can go from there. All right, because those muscle imbalances will dictate a lot of information, and it will actually not a lot of information. It'll dictate how we go about correcting them and what we want to do in terms of their exercises. So the charts here will help us greatly in terms of understanding if you have turnout, what's overactive, what's underactive. So we want to pay attention to those. As you're going through and studying, again, pause this. If you have your book, go through the book chart, because this is table 12.5, okay, in your book, and look at these overactive, underactives, all right? Valgus or knees caving in, your overactive are your TFL, your tensor fascia lata, and your adductor complex. Those are forcing the knees to come in, where underactive, your glutes and your anterior and posterior tibialis are not allowing that knee to stay outward, okay? So these are just, again, going through. For the lateral positioning, there's your overactives and your underactives, hip flexors, lumbar extensors. What you're going to notice is that a lot of these, like positioning, like low back arching, you're going to see a lot of over and underactive positions that are very similar to what we saw statically if somebody had that lower cross syndrome, okay? And then, going to that lateral view still, there's the, more upper excessive forward trunk, and then arms falling forward, your overs and your unders. There might be some carryover between them, depending upon what position they're pulling them through. So again, pause this, mark them down, look at your book, study them so that you know for a test what your under and over actives are. So, once we go through and determine our solutions and how we can kind of, again, these are, if we know our overactives and we know our underactives, again, we stretch our overactives and we strengthen our underactives. Okay, that's the key point here. So what we do is if we stretch and pay attention more to our hip flexors, our calves, and then, just be aware of our rectus abdominis and our external obliques, then we know that, it's tough to stretch your abs, but you still can. But stretching those will help alleviate that tension that's causing you to pull forward. Whereas when you start doing strengthening exercises in a corrective format to these three, lumbar extensors, hamstrings, and the glute max, you can start pulling that person back into a strengthened positive position. So that's just one example of how we can use these solution charts to do that. So we move from the overhead to the single leg squat. Now the single leg squat is not for everybody. But if a person has scored well on the overhead squat or the overhead squat assessment, then we can move them into this. But again, if a person lacks balance, we might not want to throw this at them. We want to just make sure that we put these people in the prime location and the prime positioning so they can do it correctly. So if they have a hard time with balance, or if they have a hard time getting into that single leg squat position in general, then we would avoid this and move on, which is the single leg squat. It's not optional, but it can be. It's one of those ones where we'd rather do the overhead squat as the priority versus the single leg squat. Okay. So the single leg squat, there's your starting position. All right. Looking at squatting down in a single leg position. So this is why balance is really important. Hands on the hips, stable surface. Again, making sure that the other leg is not any more than 6 inches off the ground. You don't have to be too far. Like you don't have to lift your leg too high. It can be just about 6 inches off the ground. And that's going to then get your squat as deep as possible. Now you will see a slight bend or a slight angle change, but we're more looking about the knee and the lower ankle, because that's going to dictate the bad positioning per se. All right. Again, 5 repetitions, then you switch sides, see if there's any difference between them. Same thing as before, shoes off is optimal. Okay. If they can't, then so be it. So there's the deviation that we were explaining. The knees and the ankle are getting a little aggressive on this one here. So that's going to be the common impairment here, which we would call, again, knees flaring in, would be knee valgus. So, there's your, that's the check. There's only one really major checkpoint for this, and that is from the anterior position, and it's the knees bowing in, which is knee valgus. Is it one or the other, or is it both? Okay, because we want to make sure we know what, and then at that point, what we would do is find our solutions chart, find out what's over or underactive, and then we could go from there and make the right adjustments as needed. So again, make sure you know your overs and unders. If from the anterior view, the reason why the knees are caving in, tight TFLs, tight adductors, and then you also have, weak glute maximus and weak anterior and posterior tibialis muscles. So, one view only for that. So that one, again, it's a little tricky to observe, but it's worth observing if the person can handle it. So then we move to our pushing assessment, which is more like a standing chest press with a little bit of a staggered stance, okay? So again, this one is making sure that we see not only scapular, shoulder blade and total shoulder mechanics, but we're also looking at the stability of our hips. We're looking at the stability of our cervical spine, and then also our head for that positioning as well. All right. So again, moving through, making sure that all reps are taken care of, because you're going to do, again, more than one rep if needed. So there's their starting position. All right. Now the person's positioning with their hands is you really want to think about it being about chest level. So this person might be a little bit higher, but they could come down just a little bit if they needed to, but this is an optimal position for starting. They're going to complete the staggered stance positioning for 10 reps. Now, the weight does not have to be challenging. It could be just below challenging, but we're looking to see that even if the weight is lighter, they're still going to, if there's any compensations that they have during these lifts, you're going to see them even at a light to moderate light weight, okay? So as they push through, all right, again, this person has a nice posture. We're looking at where the handles are going. Are they going straight? Are they going up, down, etc.? Making sure they're going slow. And again, 5 reps, then 5 reps. So again, if you go back, you see 10 reps, but it's 10 reps total. 5 on the right, or 5 on the right foot forward, and then 5 on the left leg forward, because that may change up how their imbalances show. So what we're looking for is a few different things, because it's not the same as the overhead squat or the single leg squat, because this is more upper body based. We are looking for that rounding back, which we saw earlier. We are looking for a shoulder elevation. Now, shoulder elevation, kind of like, as they push out, they shrug their shoulders. That is actually quite common, and some people might actually do that because they thought that was the right way that this exercise should be, completed. And so over years of time, even if they are an active exerciser, we want them to understand that we can't have the elevated shoulders. That's not the purpose of this. We want to, if we elevate the shoulders, we take off that isolation of the chest, okay? And then the other part is if the head juts forward. Okay, so those are 3 indicators. Pushing assessment, nothing from the front, everything from the lateral. And the same thing's going to carry over to the pulling as well. So there's your checkpoints, okay, looking for those impairments. Do we have them or not? From there, we would say, okay, what can we do? There's our overactives for our low back arch, okay? Hip flexors, lumbar extensors. Then the underactives, glute maximus, hamstrings, and the abs. So again, this carryover from, the overhead and the single leg squat, from some of the things you might see with them. There is your lateral view for both the elevation of the scapula and the head forward, or head jutting forward positioning. So again, pay attention to those overactive, underactives. Know them, because you may see them come up on your test. Pulling, opposing nature, same idea, okay? Same idea, same positioning, just instead of pushing the weight forward, we're going to be pulling it back. The same premise, 10 reps. You can go a little bit. For this one here, we want that wide split stance, but again, it could be narrowed up if they have a little bit of a balance issue. All right. and then just pulling forward just like we would, 10 reps, slow and controlled, 5 on the right leg forward, 5 on the left leg forward, or vice versa. And then we're looking for the same impairments: lower back arching, scap elevating, and forward jutting head. Similar with the, the observations on your chart or one you might create, yes or no. And then same thing, we're looking at where, they're probably going to be more than likely the same over and under actives for each one. Right? So, but again, just pay attention to your overactives and underactives and see where the mechanisms are for that. And then we know, again, what to correct, what to stretch, and also what to strengthen. All right. So moving from those, again, they're still static positioning. Even though there's a dynamic movement, we're not going in motion. We're staying static, but doing a movement. So now we're going to get into the performance assessments, which have a lot more of that dynamic appeal. A lot of them are a lot of common, motions that a lot of us have done in our lifetime. All right. So looking at the right side there, the push-up test, the bench press, the squat assessment, vertical jumping, long or broad jumping, the left test, which is what we call the lower extremity functional test, the 40-yard dash, and our pro shuttle. All right, we'll go through each one of those. So your push-up test, very common around a lot of testing facilities, very common for, the Army, or any, service, for police, firefighting. They all work around push-up testing, even children in the PE classes. Okay, so there's your positioning. All right, working on that solid push-up position. Hands, should be slightly outside of the shoulders. They should be stacked, on top of each other. Elbows and knees fully extended that are neutral. And then you're going to work on moving that down and up. The client lowers their body to achieve 90 degrees of elbow flexion. All right, and then it says you're going to do it for 60 seconds. The main purpose here, assessing for upper body muscular endurance. Okay, and then like it says here, when's a good time to reassess? 4 to 6 weeks. Reevaluate your program and see how it goes. The bench press, all right, bench pressing. We know about bench pressing and how it's basically the inverse of the push-up. We're just going to be lying down versus, on our hands. All right, so we're going to be lying down. This one here is going to be more about a 1 repetition max. So we're going to be assessing maximal strength for this one. Again, this is another one that we want to think about. Is this really appropriate for our clientele? It really can be appropriate for everybody, but understand that in this case, do we really need to do it for a particular person? Or could we do it for reps and find, so there's a lot of factors that come into play with this and what we want to use it for. Okay, but make sure that we also know that a spotter is going to be required. So take a look at the positioning for your starting, and then we'll move from there. So, again, you can have assistance of unracking the bar, okay, and that's appropriate. But then once you count it off together, 3, 2, 1, 1, 2, 3, however you want to do it, and however they want to hand it off, and then from there they're going to handle that weight, and then they'll re-rack it. All right. Take their warm-up sets accordingly. Take at least 2 minutes of rest. Don't be afraid to go 3 to 5 minutes of rest as you move into the heavier weights, especially with a more active person. And then from there, you can make 5 to 10% jumps if needed. Or as you start getting heavier, it might be less than 5 to 10% jumps. But understand that you're really looking at, you're looking at 3 attempts that we're looking for there. Okay, so very, very important for that. Definitely looking at trying to, again, looking for that maximal strength. Squat strength is the same premise as the bench press. Same thing, except now we're getting into the proper positioning of, where should that person be in terms of where's their line of pull, and on their muscles. Are they engaged the correct way in terms of, where is it that they're going through, through the range of motion? And are they hitting that depth that we need to? Because we want to think that in terms of depth, we really want to think about how, again, femurs parallel, femurs parallel or lower, okay? 90 degrees of hip is optimal for most people, but if some people can go lower than that, that is, and they're maintaining their posture, I am not opposed to them going lower, especially if they are doing it for specific reasonings, okay? So that's really critical for that. Now, when we look at, the squat itself, we really want to think about how the barbell sits depending upon what kind. Really, the barbell wants to sit on those upper traps. We want to think about bringing the elbows back slightly to create that little shelf for the barbell, okay? And then from there, we want to release the hips and the knees almost simultaneously, but it's never the knees first, okay? More of an upright chest, you don't want to have an exaggerated lean forward, all right? So we want to be always neutral with low back, okay? Trying to maintain optimal foot positioning that will translate into optimal knee positioning, and that will really make it so that we go to the right motion. So again, you can help a person come off the rack, but really it's safer for them to do it themselves, all right? Go ahead and do your assessment, do your reps, and then go ahead and take your rest as needed, and then you can add load as needed. They say 10 to 20% of the initial load, all right? And then go from there to add accordingly, because again, it may not be in 10 to 20% increments as you start getting super heavy. 3 attempts, to try to get the maximum amount of weight you can, all right? And then from there, you can go into, like it says there, you can go into what they call the Appendix A, and calculate that person's 1 rep max if you were to do a 3 rep assessment. But if you have a person trying to achieve a 1 rep max, whatever they get is their max strength. So vertical jump using this is actually a Vertec device, all right? It's with the little bars here that you're trying to hit. So again, that person is going to set up underneath. What you will do is you will set up that person to their standing height. Okay, so what you do is you have them stand tall. You have them extend one arm up in the air without overextending and not lifting. All right, and then from there, what you do is you would drop the Vertec down to the bottom bar would touch their top of their finger. At that point, they would have to jump up squat down, jump up as high as they can, and swat their hand to hit those bars at the highest level. Now, if a person, say you're working with an athlete who has a very high vertical jump, or you're working with like a power lifter or an Olympic weightlifter, and we know that they're going to be able to go above 24 inches because that's the max that you can get on those bars, then we can adjust this standing height here by adding things like from where their standing height is, adding 12 inches to that, because this little pole here that comes up and down that you adjust actually has indicator lines of inches that you can do, okay? So that's where we want to be able to take us through, go and pressing forward with that, okay? And then they squat down slightly and then jump up as hard as they can, explode up off the ground, and then, like I said, squatting, pressing through, and swiping their arms to get the highest height reach that they can. The long jump, on the other hand, is going out versus up. Same premise, explosiveness, horizontal. This is horizontal power, where the vertical jump is vertical power, okay? Very big on performance indicators. So same thing here, like it says, they want to use a tape measure, and what you want to do is be able to, have your line marked where you're going to jump from. That person starts behind the line, gets it to that slightly squatted position. It's a 2 foot jump and a 2 foot land. So however far they need to squat down, you don't want to, you want to be explosive, so you don't want to do a full squat and then jump out. You want to think about bending down, again, optimal positioning with the hips hinging and the knees bending slightly and exploding off of the, they say the heels of the foot, but really the whole foot, to be able to explode out and up, or more out than up though, but you want to still be off the ground. All right, from there, 3 attempts, just like you would with the vertical jump, and the score would be the highest one you would get, and then assess as needed. Okay. So jumping out and then that tape measure from wherever they land, all right, wherever they land. Now, if they land on 2 feet and then they fall a little bit forward, it still goes by where the heel landed first. So sometimes this is really good to do in like a sand pit if you have one, because you can see where the feet land. Other times you might have to say, okay, you're going to have to redo that one because you have to be able to land and then be able to stand up from where you are to get the right distance traveled. The lower extremity test, or lower extremity functional test, or the left test, is where we would have 2 cones set up about 10 yards apart, okay, so about 30 feet. And what you're going to do with them is you're going to have them go in multiple directions. So if you look A through G, those they have to do it in that manner. So starting at cone 1, so if we're over here on the right side, we want to think about starting here. We're going to sprint forward. We're going to back pedal back. We're going to side shuffle one way, side shuffle back. Okay? So now we're coming, now from there, karaoke. Now karaokes or karaokas, those are where the forward foot crosses over the back foot and then behind, forward and behind. All right? And then lastly, you would finish off with a sprint, and then that would complete your time for how long it took you to do the 1, 2, 3, 4, 5, 6, 7 different positionings throughout that whole time. So really, if you think about it, that's 210 yards total coverage, or excuse me, 70 yards, 210 feet covered over the course of a very short period of time. So again, this can be for many different people, but again, think about who the right clientele and the right demographic this would be for. 40-yard dash assessment, again, who is this for? Because we want to think about, what is the whole purpose of this? It's acceleration, it's reaction, and it's actually maximal sprint speed. How fast you go from the start point to 40 yards, okay? So once that, and basically how it works is as soon as that person makes their first movement, you start the stopwatch, and as soon as they cross the line, you end the stopwatch, and it's their fastest time of how many particular trials you want to. Typically, the first one is always the best, but a person might just be getting warmed up, so you can have them do like a couple of 40-yard dash runs as quick as, as not as quick as possible, just to kind of ease into the flow, and then they'll say, okay, now you have one attempt to get it done as fast as you can. So it just is up to you on how you want to achieve that. But again, it's the fastest sprint speed of that 40-yard distance. The pro shuttle is this is a combination of many different things: acceleration, deceleration, agility, and then control. And what it is, you're going to have 3 cones though. You're going to have 3 cones that are set up 10. The middle cone is the middle. So the 2 end cones are 10 yards apart. The middle cone is halfway, so 5 yards in the middle. And then from there, what you would do is if you follow the arrows, starting in the middle cone, you're going to sprint to the right as fast as possible. Tap that cone. Sprint all the way to the left cone, tap that cone, and then you will run through the middle cone. And so from the first movement, tap the first cone, tap the far cone, run through the middle cone, and whenever time you run through that middle cone is your final time. So you're going to go 5 yards, 10 yards, 5 yards. That's why it's called the 5-10-5 or pro shuttle drill. So very quick, very explosive. There's a lot of speed up, slow down, and that really is one of the things that is going to make this time faster or slower, and very dependent upon that is whether you are, you can slow down, speed up as fast as you can. All right, so again, regular testing on this to be able to get us to show what we're really, whether we're making improvements, especially if this is a really important one for athletes in particular. But again, you can always work with any other, client that you want to. Performance-based ones, again, can be worked with whoever you want to. Because again, it's your assessment for your general fitness, for weight loss goals, whatever. But again, if you're doing it for weight loss, this probably isn't a test that you want to do. If you're doing, but for general fitness, probably not the test you want to do. But if you want to, a person wanted to show that their performance is going up just for themselves, then go for it. But if it's, weight loss isn't really going to affect this here because it's more performance based. So that's the end of our performance based testing. So what we want to make sure of again is what is the order of our sequence here. And really the main thing is this bottom chart. We want to do our paperwork first, our pre-participation screenings. We then want to do our physiological assessments. We talked about those. That is your heart rate, your blood pressure, and your heart rate and your blood pressure are the main things. You can do things like breathing rate and things like that. From there, you'll go to your body comp, okay, BMI and body comp. You can then go into your posture and movement assessments, into your cardio assessments, and then your performance assessments. This should be the transition points on how you want to do it if you're going to do it all in one day, okay? But remember this sequence, it's fairly important because it's going to be put onto your test for sure. They want to know the sequencing of that, okay? That's how we get people in. That's how we sequence our assessments. That's how we get appropriate non-skewed results. So again, be very aware of your clientele. I said this a lot throughout, but overweight and obese considerations and modifications, all right? Make sure that their pre-participation screening is complete. Don't assume that just because they're, and this is no disrespect to anybody, but just because your person is larger, overweight or obese, does not mean that they don't have any ability. And that's really a bad assumption to make because people are going to be surprised when it's like, I didn't realize they could do that. But that's such a horrible thing to have to say because you went in with preconceived notions. So don't do that. Okay, it's very important not to do that. And then really the main thing here, like I said, is consider limiting movements that require someone to get up and down. So if you're going to do something like a push-up test, you don't want to keep following that up with an up and then a down because it's hard for them to maneuver. Okay? So how do we modify? Change up the depth of their overhead squat assessment. Don't do the single leg squat assessment. Okay? That's going to, really hurt that. But if they show proper strength, then let them try it. All right? Have them do a pushing or pulling assessment in a 2-foot stance versus a staggered stance. Okay, have them just stand so that, or for whatever's more comfortable for them. But again, don't assume. Make sure that you know what they can do. With youth, on the other hand, youth can do a lot of things that we sometimes, they're not little adults, but at the same time, they're also plenty capable of doing a lot of things. Just be aware that trying to give them like a 1-rep max assessment may not be appropriate. So we might want to think about considering that. All right. But, again, that single leg squat, if they're very iffy on their balance and coordination, we might not want to present that to them. All right. So how do we modify? Instead of max strength, do muscular endurance, do more reps than we would versus a 1-rep max test. Okay. The other thing about it too is don't be afraid to do the push-up test, the left test, the pro shuttle, the vertical jump because they're fun. Okay, children like them and they actually will, if you make it more entertaining for them, they may achieve better results versus making it like burdening for them. Older adults, again, know your people. All right? So, but again, don't let, just because they're older, don't let their ability cloud your judgment or your judgment cloud what their ability level really is. All right. So we just want to make sure that, again, up and down off the ground based on their ability. That's another one, but just be aware. And then also pre-participation screenings are going to be optimal because we don't know what they're coming in with in condition-wise, because sometimes you can't see osteoporosis, you can't see arthritis. So we just have to be aware to get as much information as possible. So again, overhead squat depth, like the overweight and obese, is going to be optimal. Try to figure out if their single leg squat is necessary. And then again, more comfortability for pushing and pulling assessments. Now, prenatal, we're talking about pregnant women. Be very aware of what you're getting yourself into with this. Again, movement patterns are going to be very different for them because they have a belly. So that's going to be a little bit different for them. That's the modification that you're going to be aware of. So again, don't take that they can't do something just because they're pregnant, but understand that, we want to make it more comfortable for them more so than anything else. With the assessments, up and down off the ground is not going to be the best choice. So we're going to avoid doing a lot of that. And then again, depending upon how far along they are, this might be something where it's, if they're in their second and third trimester, we're not going prone or supine. We're not going prone on the back, supine on the belly to compromise their pregnancy. So again, overhead squat, check the depth. They might not be able to achieve it, especially if they're later on in their pregnancy. I would, they'd also do, but I would recommend it from professional experience. Don't do the single leg squat because their center of gravity and center of mass is different. And then again, pushing and pulling is going to be based on what their comfort level is. Okay? So again, all these assessments are going to just keep getting, your people better, and they're going to, as they go through their programming, and it just, the next time you do it, when they start seeing the results, it makes them happier and wants them to, then they want to stay and they want to keep getting better. So the more options you give people, the better it is in terms of, the scores may not be great initially, but the more you work with them and they start seeing, wow, I'm doing very well. And that's why, always looking at the scale is not the most important thing. It's like, in 2 months, just say 8 weeks, you went up 10 reps on your push-up assessment. That's a big achievement. So, again, reassess so you can give new and make things less stale. Okay? So again, our assessments are meant for getting info, whether it's generic information or performance information. All of this builds that, takes all those puzzle pieces and puts them into one beautiful picture. And then from there, we can start thinking about that next step, which is going to be, what are the phases that we want to pay attention to for our exercise, and how can we make the best exercise plan possible? So everything moving forward from here is going to be the sections of the actual workout plan that we want to focus in on. All right. So our chapter 13 will start with talking about integrated training, and then we'll go from there. So again, thank you, and let's continue to move on to our next one.